Good evening, dear viewers, and welcome to Collage. We're going to be with you for the next hour right here on, whether you're watching us on KTV2 or on KTV5, and we're going to be bringing you a lot of great segments that we have lined up for you, and of course special segments that are lined up for the holy month of Ramadan. We hope you're all enjoying this holy month, and maybe today we're going to focus on a topic that is very important. I think it's one of the most important topics. Maybe our strategy right here on Collage is we always try to make a difference. We try to make a difference whether it's with your lifestyle. Now, lifestyle includes so many things, whether it's the way you live, whether it's food, whether it's spending, whether it's various issues. I mean, there are so many things that would all lead to a proper and healthy lifestyle. So today we do have a very, very important topic. Maybe I'd like to keep that as a little secret until we get to our guest for this week right here on Collage. So just be sure to stay tuned for our guest, because I'm sure you're going to be learning a lot of very useful information. But right now we're going to go for a very short break, and we'll be right back. Stay tuned. And we're back, and of course we are ready to start off this week's edition of Collage. Now, we usually start off with our social segment. What our social segment is all about is that we just try to raise issues or raise problems, or just whatever is on anyone's mind. We do have a lot of problems that occur in our day-to-day lifestyle, especially within society, because life has become very fast. It's become very, very stressful. A lot of issues are, arising within our society. Therefore, we try our very best to maybe focus on them, maybe not give you a solution, but try to make you think more clearly about those certain issues. Of course, our topics are related to Ramadan, since we are in the holy month of Ramadan. And we're going to go and join Faisal and see what he has lined up for us this week.
Thanks for joining. Now, we all know that with fasting, we're not only depriving ourselves from food, we're also depriving ourselves from a lot of substances that we might have been used to, such as caffeine or nicotine, and that can cause a bad mood in the first couple of days, especially. There are ways that we can do, and things we can do to help ourselves not be so agitated and deal with that aggravation, and deal with people that are going through the same thing. This is our question for this week. Stick around and let's go get some answers.
I can't control myself in this month, Ramadan month. It is for praying, for read the Quran. With this, I can't control myself. Okay, I should control myself, and for this, because it is important for a human. When he is in Ramadan, he should control himself.
Well, of course, you miss something in Ramadan. Fortunately, I'm not a smoker. I used to be a smoker. Actually, it was much worse in the past. But now, I really miss the coffee. That's what because I got used to have a couple of coffees in the morning, and of course, it makes me a little bit of nervous. But with a little bit of dua, supplication, and reading Quran, so I think I can control myself for the people who are dealing with me, I can understand when I feel that somebody is, getting a bit nervous, especially in the first couple of days in Ramadan. I take it easy with him because I know the reason behind that.
Okay, I don't think so that it is very big problem, because some of the people, not all the people. So I think the people, they have to be patient, because the month it is from our religion, so I don't think it is very problem. And the people should not do like this, because it is Ramadan, so we have to be patient.
In Ramadan, usually because I change my habit always, so I prepare myself before 1 week of Ramadan. I fast twice a day, so when Ramadan come, I prepared for that, so I don't feel like before I used to get headache. I'm controlling myself in eating first 2-3 days, because if I eat too much, I feel very heavy, very tired sometimes. So Alhamdulillah, no, I am preparing myself before Ramadan, just fasting 2 days, twice a week only, or 2 days exactly. I fast, then I be prepared for Ramadan.
I can read Quran, I can play sport, I can make some important things like read books, talk with my kids, make everything better for me.
Well, basically Ramadan is the holy month, and it's usually for people need to pray and be patient, and it's a family month, so you need to be more with your family, and if people are angry or get disturbed, you have to be more patient with them. And during fasting, you need to do stuff that you don't usually normally do, like praying and reading Quran and stuff like that. That's it.
Actually, I don't care about food and water, but smoker, this is a bad problem for us, especially in the first 2 days or 1 week maybe. Okay. Usually, as you said, we become nervous. We are waiting for Maghrib prayer, just to take the beginning, just we smoke. In the beginning, just smoke. We forget, before we pray, before we eat, before we drink anything, even juice, even tamar or something dates, no, just we take a cigarette, directly for cigarette.
Okay. Well, as we can see, it's very difficult for us to stay focused during a time where our body and mind is going through withdrawals. But if we try to make an effort to stay focused, read a book, read the Quran, or whatever it is that takes our mind off of our agitation, can actually do us a lot of good. So until I see you next time, have a good one.
Thank you, Faisal, and we'd like to, of course, thank everybody that's watching. And right now, I would like to get to our guest for this week right here on Collage. Now, our guest is no stranger, but it's always interesting talking to Dr. حيدر الحداد. Dr. حيدر is the assistant professor at the Business Studies College in the Management Department. We'd like to welcome you to Collage.
Thank you. You are more than welcome.
Now, Doctor, it's always very interesting, let's say, and it's very, well, I don't know, it's very crucial. It's a very important topic that, I don't know, we talk about it a lot, but maybe people don't implement it, and it is an issue. We are having major problems due to expenditure, due to money, due to lack of knowledge on how to manage or budget your money properly.
Yeah.
How to get out of debt. It seems like everything these days is, whether it's, I'm giving a little bit of a long introduction, but I'm telling you the concerns of people like myself and regular people that, live a normal life. You get attractions like, oh, you can buy and install it, it's not a problem. Oh, you can take this and you install it, it's not a problem. you have a credit card that has lower interest rates, and you know, they put you a higher credit limit, etc., etc. You know, so, and of course, let's not even go towards the loans, because the loans all by themselves is a major issue, you know.
That's true.
So everything is basically major attractions. So, you know, that's why, of course, we chose you to be a guest on our show this week, and maybe we can clarify a little bit to people, you know, where we're going wrong. And now, of course, we know that this is Ramadan as well.
Inshallah.
So, Doctor, at the very beginning, maybe if we can just explain a little bit that the wheel, okay, of expenditure, the cycle itself, if we can just start off with that.
I think the people get used to spend money regardless to their salary. If his salary 500, he will just spend it all. If it is 1,000, he will spend it all. Maybe because it's related to the way we think. It says in Arabic, "Asrif ma fil jayb, yarzuq Allah ma fil ghayb." Just if you have money, spend it, and Allah, inshallah, will give you in the future. Nobody think before spending. If people have just like a signal, you know, when they'd like to spend any amount of money, just think a little bit, then spend. If they do that, it will be a major change in their life regarding to spending. Another thing is due to our habits. You know, people in Ramadan, for instance, buy a lot of food. They eat it or they dump it, it doesn't matter. They buy a lot of food. Even when we like to, for instance, travel, we don't do any planning. We just have, for instance, if I have 2,000, okay, I have 2,000, I have to spend it. Okay, let's go for a trip or for a short trip to spend all this 2,000. Without any thinking about the consequences behind that. If I will be in debt, or I have to plan or buy a car, for instance, for my son, or prepare a small budget for my daughter, for her, if she's studying private school. So people just do what they used to do, and this is not right, because we have to focus. If we are doing something which is not right, we have to modify our actions. We have to look to the world in a clear, sharp look. We don't have to be very much fascinated regarding to the media or the advertisement of, okay, get a loan, we'll give you 70,000 KD. And how you will pay it? Okay, you will take this 70,000 KD, then how you will pay it back? It will take all your life, and maybe again 10 or 20 of
and your children and their children might pay for it.
And they will still, you will never live a quiet, peaceful life, because we say that death, it's half of the pain that person will face. Sometimes the death will change his, you know, his face. You know, the gray hair will grow very fast due to death, because he lost the vision. People should
death,
due to death, so he should focus on that. And it's a very important concept. People should very much look at it in a very careful and try to adjust or change
their life, their way,
to
their
live
way of
better.
thinking.
Yeah, to live in a better life.
Of course, that's true, Doctor. But I think we just, you know, right now we exploded a bomb, and everybody's complaining from it, but we're going to tease them a little bit. We're going to go and join the Dr. Munal Al-Sghayr and see what she has lined up for us for our nutrition segment. But we'll be right back to talk, of course, our topic of this week, which is spending habits, okay, with Dr. Haydar Al-Hadad, so stay tuned.
Good evening. Today we're going to talk about special groups that they suffer from a nutritional disease and how Ramadan can affect their diet and their treatment. These people who suffer from diabetes mellitus. Normally we have a normal level of glucose in our blood. Those patients who got diabetes mellitus, they have a higher level of glucose in their blood. For that, there is a lot of consequences for this high glucose level in their blood. There are two types of diabetes mellitus, type 1 and type 2. Type 1, previously known as insulin-dependent diabetes mellitus, IDDM. This type of diabetes mellitus can be diagnosed in early life, mostly before the age of 30. And in this type, the pancreas, which is the source to release insulin, the hormone responsible for the intake of glucose from the blood to cells, the pancreas is defected, mostly by immune system. The insulin will not be produced by the pancreas, so the glucose will not enter the cells. This type of diabetes mellitus, the treatment mainly include injections of insulin. We provide insulin for the patient, so it will aid the entrance of glucose to the cells. The other type of diabetes mellitus, which is type 2, known as non-insulin dependent diabetes mellitus. This usually diagnosed after age of 40, and most of the cases of diabetes are from this type. And it's mostly related to the lifestyle and dieting and some genetic factors, i.e. people who are suffering from overweight, obesity, especially those who get a lot of fat in the abdomen area, they are most likely to have a high risk of forming a diabetes mellitus. Now, in Ramadan, normally our glucose will little bit come down in our blood, due to the fact there is no continuous food or intake of food. But the body, the system in our body can nicely adjust that by the breakdown of storage glucose form in our level, which is a glycogen, and also the synthesis of a glucose, internal synthesis of a glucose, so that the glucose in the body or in the blood will be into the normal status. Those who suffer diabetes, they should be very careful in Ramadan. In fact, the decision that they can fast or not fasting Ramadan, it's highly related to their negotiation, if you can say, and the advice of their doctor. It's very important that any diabetic patient go to his doctor prior to Ramadan in a good time and discuss this matter with him. Can I or cannot fast Ramadan? There is several people suffering diabetics that most of the time they cannot fast Ramadan, mainly type 1 diabetic patients. Those patients from type 1 or 2 who cannot control their diet or will not listen to the advice of the doctor. Also a pregnant diabetic patient. Those patients that they have a lot of other health complications like hyper blood pressure, etc. They cannot fast Ramadan. Also, any diabetic patient that through Ramadan, if he starts fasting Ramadan, he suffers from 2 or more episodes of hyperglycemia or hypoglycemia, i.e. low or high blood glucose. These people are not encouraged to fast Ramadan. Those people who are encouraged to fast Ramadan are with type 2 diabetes mellitus, and mostly those with overweight body, because restriction amount of food intake in Ramadan can help them to reduce their weight and in the same time enhance their health status with reduction of their weight. Once you decide that you are going to fast with your doctor, there are several things it's very important to mention. First of all, that you should have this awareness. Once you are in hypoglycemic state, that means your blood glucose is low during the fasting period, terminate your fasting. Don't fast even if it is a few minutes before the sunset, because it's really harm to your health. Secondly, you should continuously monitor your blood glucose at home so you are aware what level of glucose you have. Also, you should continuously monitor your weight. Now, it's important also to follow the 3D triangle of fasting Ramadan for diabetic patients. First, control your diet, that is diet control, and daily activity and drug adjustment. Now, for your diet, it's very important to eat directly once you hear the adhan for the sunset. And try not to eat a big portion of food, so you will raise the blood glucose. Try to make it small portions through the non-fasting period. Also, it's very important to eat suhoor and make it as late as possible, because if you don't eat suhoor, don't try to fast next day. Try not to eat fatty food, not to have a lot of caffeine, etc. Now, the other thing is the daily activity. Keep maintaining your daily activity, especially after the breaking fast, which is after iftar, and try to, if it is the end of the iftar time, fasting time, which is after the afternoon, you try to have a nap or sleeping to reduce your activity. But after that, you can follow a nice activity exercise. The third thing that you have to adjust your drug, and this is totally with your physician, with your doctor, to tell you how to adjust your insulin injection if you are from type 1, and how to adjust your medication if you are type 2, especially this medication that you can shift the morning and midday doses into the sunset time and the night doses to suhoor, but this is totally to your doctor decision. With this 3D triangle, you can avoid any complication through the fasting in Ramadan. God bless you all.
We'd like to thank Dr. Munal Zghayr for all of her wonderful advice when it comes to nutrition and food knowledge. I think nutrition knowledge is also very important. We need to change our, let's say, concept of food and our way of eating and our habits as well. And not only eating, because we are, it's a whole lifestyle in general, like let's say a lifestyle, whether it's food, whether it's money, which is something that's also very important. We're talking about that with Dr. Haydar al-Haddad. And Dr. Haydar, we left off with how a person is always spending without thinking, and it's a never-ending circle, you know. It's one thing comes after the other. Okay. So right now, maybe we'd like to, since we are in the holy month of Ramadan and all of that, let's say the major, let's say, expenditures, or what they can be or what they come down to.
Yeah, the major spending, especially in Ramadan, it's in the grocery. If people focus in this area, they might save some money. And there is few tips. If you go shopping in the grocery, you can save some money.
Okay. So this is for buying the groceries themselves.
Yeah, buying the grocery. For instance, never shop when you are fasting. If you are hungry, you will just go and put in the cart without any focus. That's true. Because this is emotionally drive you to buy this food and this food, although you might not need it, just because of hunger. Another thing is try, when you go to the supermarket, try to get a list with you and try to make sure to buy only what's
on the list.
Yes, in the list. And if it's possible, although the people are not used to, try to carry a calculator, to manage how much you will buy. If you put a fixed budget, let's say you put 80 KD to buy from the grocery. Okay, you stick with that. If you reach that, you have to try to go out, leave the supermarket.
But you know, doctor, even going towards the point of the calculator. In every phone right now, mobile phone, I think everyone has a calculator in the phone. All the phones have calculators in them. So you don't have to specifically have a calculator with you. You can just use your telephone, so it's not going out of your way.
That's true.
Know? Okay.
But unfortunately, like I said, people don't use it. In the Western countries, most of the people have the calculator. In fact, the calculator is there in the cart.
On the shopping cart itself?
Yes, in the shopping cart, so you can measure how much you buy. So you have a fixed budget. Another thing, try, if necessary, just take with you one credit card for emergency uses only.
Okay.
And while shopping, even in the supermarket, try to compare. Sometimes you'll find the same thing you want, but different brand. Don't just insist in buying the same brand you used to buy it. Although this is another thing related to habit, because you buy always brand A, for instance, you keep buying this product for 10 or 20 years. Give it a try. Try to buy another product, the same, but different brand name. You might find it's better and price less than the other one.
That's true. I mean, doctor, with things like, let's say, comparing, it's always good to compare, because now they have everything on the labels that are on the, let's say, the whatever it is that you're buying. You can find identical, the contents of whatever it is that you're buying. It's the same thing, maybe even better, but for less. Just because it's either locally made, for instance, and the other one is imported. So one would be cheaper, but it's just as good or maybe even better than something else, and people wouldn't notice that.
Yeah, and in fact, we'd like to encourage some that is produced locally, you know. Another tip, maybe also try to not to bring your kids with you while doing shopping. Most of the people, if they bring their children with them in the supermarket, they will end up buying a lot of things for their children that is not maybe healthy, and it's not needed, because the child will cry, I need that, and the father or the mother or both will buy this thing for the child, just to let him
so he won't give
him.
them a bigger headache.
Yeah. Another thing, try when you buy anything from the supermarket, try to be very practical. When you buy something, ask yourself, do I really need that? If the answer is no, forget about it. Don't buy it. Don't be attracted with the shiny of the product, or it looks, it's a wonderful product.
The package itself.
Yes. Ask yourself, as I said, do you need this product or not? If you don't need it, just forget about it. Another thing is try to set a budget before leaving the house. You say, I will go to the supermarket to spend this amount of money, and try to stick with that amount. With these steps, and of course it's related, as I said earlier, it's related to the way you think about spending in general. Try to change some habits, even if you get used to it for, let's say, 10 years. Give it a shot and change some of your habits. You might find the results are very surprising, and with regard to the reducing the cost and saving some money. And maybe all the people just, you know, in Ramadan especially, spend a lot of money in food. Although Ramadan is a fasting month, people should get many lessons beside, you know, eating wonderful.
That's true, because we're really not starving. You know, there's a whole point to fasting. It's not because it's not torture and it's not starvation. It's you know, it's even healthy. Fasting is very healthy. So you shouldn't ruin it by going after you break your fast, by just sitting there